BD SafetyGlide Needles are designed to keep clinicians safe from accidental needle stick injuries. SafetyGlide Needles have BD Activation Assist technology, making a safe injection easier and more efficient. The unique Activation Assist technology feature means a fast and smooth single-finger activation while keeping the finger well behind the needle, requiring minimal training and virtually no change in clinician technique. SafetyGlide features the BD PrecisionGlide needle technology and has a stainless steel needle tip cover. The needle is detachable and can fit on any ISO-compliant Luer syringe and facilitates standardization and SKU reduction across the facility. To aspirate medication from a vial, attach a BD blunt fill or blunt filter needle to an ISO-compliant hypodermic syringe. Twist when attaching to a Luer lock syringe. Push firmly when attaching to a Luer slip syringe. Pull the shield straight off the needle. Then, draw up the medication to be administered in accordance with your institution's protocol. Passively recap the BD blunt fill or blunt filter needle. Detach the needle from the syringe and immediately discard into an approved sharps collector after single use. Attach the SafetyGlide needle to an ISO-compliant hypodermic syringe. Twist when attaching to a Luer lock syringe. Push firmly when attaching to a Luer slip syringe. Before use, pull the shield straight off the needle to avoid damaging the needle point. Administer the medication following your institution's protocol. For user convenience, the needle's bevel-up position is oriented to the safety cover. Activate the safety mechanism immediately after removal from the patient by pushing the safety shield completely forward until the needle tip is completely covered. Use a single-handed technique and activate the safety mechanism away from yourself and others. Then, visually confirm that the safety shield has fully advanced and the needle tip is covered. After activation, or if unable to activate, discard immediately in an approved sharps collector after single use. Follow your institution's protocols for aseptic technique and skin preparation. Activation of the protective mechanism may cause minimal splatter of any fluid that is remaining on the needle after injection. Follow your institution's policy for safe disposal of all medical waste. This guide is not intended as a replacement for the detailed information contained in the IFU. Please consult BD product labels and package inserts for any contraindications, hazards, warnings, cautions, and instructions for use.